Today we are reading topic asthma from Harrison. So let's start. Asthma is a syndrome characterized by airflow obstruction that varies markedly both spontaneously with treatment. So the word here is airflow obstruction. Asthmatics harbors a special type of inflammation in the airways that makes them more responsive than non-asthmatic to a wide range of triggers, leading to excessive narrowing with consequent reduced airflow or symptomatic wheezing and dyspnea. So from the first line we picked out the word airflow obstruction. And from the second line they are giving us the idea what is the difference between the people who have asthma and the people who don't have asthma. The people who have asthma shows certain kind of inflammation. So they are also telling us what features are seen in the patient in which there is reduced airflow. Wheezing is appreciated and shortness of breath, or in other words I can say dyspnea, is appreciated. Reduced airflow, so there is narrowing. Okay. The next line says the narrowing of the airways is usually reversible. But in some patients with chronic asthma, there may be an element of irreversible airflow obstruction. So the third line has very much big essence, because you know that there is one more disease which is known as COPD, and generally examiner questions ki is asthma reversible or irreversible. So the answer is asthma is reversible. Which is the disease which is irreversible? That is COPD. Okay. Asthma is heterogeneous disease with several phenotypes recognized, but thus far these do not correspond well to specific pathogenic mechanisms, endotypes, or response to therapy. The increasing global prevalence of asthma, the large burden it now imposes on patients, and high healthcare costs have led to extensive research into its mechanics and treatment. Prevalence. Asthma is one of the most common chronic diseases globally and currently affects 300 million people worldwide, 250,000 deaths annually. The prevalence of asthma has risen in affluent countries over the last 30 years, but now appears to have stabilized with 10 to 12% of adults and 15% of children affected by the disease. In developing countries where the prevalence of asthma has been much lower, than there is rising prevalence which is associated with increased urbanization, कि जो लोग हैं वो गाँव से शहर की तरफ जा रहे हैं. Okay. The prevalence of atopy and other allergic disease has also been increased over the same time, suggesting that the reason for the increase are likely to be systemic rather than confined to the lungs. तो वो लोग ये सोच रहे हैं कि जो ये एलर्जिक डिजीज़ है उसका रीज़न क्या है, सिस्टमिक rather than lungs. Most patients with asthma in affluent countries are atopic with allergic sensitization to the house dust, mite, dermatophagocytes, pteronemus, and other environmental allergens such as animal fur and pollens. So there they have given us another important line, that is allergic sensitization. What are the risk factors for asthma? House dust, mite, the name is here. Environmental allergens, कौन कौन, जैसे किसी के घर में डॉगी है तो उनको उसी से एलर्जी हो जाती है, एनिमल फर, या फिर जब सीज़न चेंज होता है तो पॉलन्स आते हैं तो पॉलन्स की वजह से. Asthma can present at any age with a peak age of 3 years. In childhood, twice as many males as females are asthmatic. So they want to show that ratio is 1:1. But by the adulthood, the sex ratio has been equalized. Long term studies have followed children until they reach age of 40 years suggest that many of asthma have become asymptomatic during adolescence, but asthma returns in some during adult life, particularly in those with persistent symptoms and severe asthma. तो दे आर सेइंग कि बचपन में होता है, बड़े होके ठीक हो जाता है, लेकिन थोड़े टाइम बाद फिर से हो जाता है. Adults with asthma, including those with onset, where were we? Adults with asthma, including those with onsets during adulthood, rarely become permanently asymptomatic. The severity of asthma does not very significantly change within a given patient. Those with mild asthma rarely progresses to more severe disease, whereas those with the severe asthma usually have severe disease at the onset. Death from the asthma are relatively uncommon and in many affluent countries have been steadily declining over the last decade. A rise in asthma mortality seen in several countries during the 1960s was associated with increase of short acting increased use of, so this is very important line I feel, कि a rise in asthma mortality has been seen in several countries during the 1960s was associated with increased use of short acting inhaled beta adrenergic agonist. But there is now compelling evidence that the more widespread use of inhaled corticosteroids in patients with persistent asthma is responsible for the decreased mortality in the recent year. So they want to say that when they were using short acting beta adrenergic agonist, when they were using SABA, तो डेथ का रेट क्या हो गया था, बढ़ गया था. बट जब उन्होंने इनहेल्ड कॉर्टिकोस्टेरॉइड्स यूज़ करने शुरू किए तो डेथ कम हो गई. मेजर रिस्क फैक्टर्स फॉर asthma deaths are poorly controlled disease with frequent use of bronchodilator inhalers, lack of poor compliance with the inhaled corticosteroid therapy, and previous admissions to hospitals with near fatal asthma. It has proven difficult to agree on the definition of asthma, but there is a good agreement on the description of the clinical syndrome and disease pathology. Until the etiological mechanism of the disease are better understood, it will be difficult to provide an accurate definition. So people, till now, what all information we have gathered? Just let's revise once, because if we will go further and further, there will be no use. So the first point you should know is in asthma there is airflow obstruction, there is inflammation, wheeze, dyspnea. It is reversible disease. Risk factors are allergens such as house dust, mite, pollen grains, animal fur. And they say that male is to female ratio is equal. Then they say that if they are using SABA on consequent basis, it leads to death. But when they are using inhaled corticosteroids, death rate has been decreased. So that's all for this video. We will discuss risk factors and triggers in the next video. Thank you for being there till the end.